Our next contestant is Diana Nole. I know Diana for many years now, president of Carestream. Carestream has done a lot of really interesting things in the imaging space, and they've definitely taken some innovative roles. I see them, I guess, from my point of view, as the PACS company that really flew in full force into advanced imaging and 3D. So much so that when other vendors have competition at Stanford 3D places, the 3D Bake Off or whatever it is, other companies bring their 3D workstation, they just bring the PACS workstation because that's how they see things. And so I think that's pretty impressive. And they certainly were out there in mobile. In trying to be at the forefront and getting their ways out there. They took a completely different approach to the issue than Mark Kane did, possibly because of the difference in timing when they're coming into it and they're looking at it. And I think it'll provide a great contrast to the way that they approached it. Yeah.
Thank you, David. This is a very interesting topic and certainly one where we also watch other vendors and are looking to see where the industry and the marketplace is going to go. So one of the things that we first look at when we decide which direction we're going to go in terms of our mobility applications. So as David said, we have been historically coming from the position of being more of a radiology kind of production work environment, workstation PACS, RIS, but we've understood that the aspect of who you're communicating all of this information to is continuing to broaden, and the requirements of the referring physician community or the patients or others that want to see this information is completely different than perhaps the platform that you use for your diagnostic PACS environment. And that was something where we actually needed to make a decision, and so we have made a decision on going more with an agnostic approach from a mobility application standpoint and optimizing it specifically for maybe the iPad in terms of being able to use some of the functionality that you innately get on an iPad, but not specifically having it just run on an iPad. So, this is an interesting bit of information. I think it corresponds to what Dr. Hirschorn mentioned, is that, everybody out there seems to have a smart device, but physicians are ahead of that curve. And, but you will see that even with this, you do have a little bit of disparity in terms of what people are using. And so as a vendor, we always have to typically look at, is it good to just ride one horse relative to technology, or making it a little bit more agnostic, especially when you're starting to talk about a very broad community that may be accessing this information. When it was perhaps just the radiologist, it was a little bit more controlled, as Dr. Hirschorn said. But when you start to think about the broader community that might be accessing this, you do have to take into consideration what they might be using. So we try to look at, what to do relative to what you want to put on kind of a mobile application app, or what is really going to be the production workstation environment. So, these are things that are continually changing. I'll even mention a little bit about one that I would probably say I would change from what I have on the slide today. But when you think about the radiologist reviewing the imaging results, they may want to have it either in a dedicated app or just to have it kind of launched from some other application. It really depends on what they might be coming into viewing the imaging results. When we take a look at our users from a referring physician standpoint, most of the feedback that we're getting is that you don't need to make a dedicated application for that community. They're going to go into that information through the electronic medical record. And so when you get down to the consideration around referring physicians, we think that obviously the EMR companies, most of them are making dedicated applications. And so we would just kind of come through that as the imaging enablement piece of that. The last piece is an interesting one when you think about patients. So our platform that we have for both our referring physicians is the same technical platform that we're using for the patients and anyone else, surgeons, et cetera, that might be wanting to access the information. So we have decided that that's the platform that would be for the broader community, separate, at least at this point, separate from what we're doing our diagnostic workstation on. So the patient's accessing the EMR. So I said no app here, which is interesting because I think that may just be with the fact that what we had been hearing was that most of the patients were going to come through a portal. But that seems to be changing now, and we actually have started to see both providers providing dedicated applications. We've seen one recently from the Mayo Clinic. There's probably many others that are out there. But we also think that that's going to evolve. So that may actually be one that will change a little bit in terms of how that would be viewed. So some of the general things that probably aren't anything new, but stuff that we really try to test ourselves against is trying to be able to think about an ad hoc environment and be a little bit more flexible in the use cases of how it's going to be used. It's not necessarily as much of a structured workflow as you find in a PACS workstation. So the way we design it needs to be a little bit more okay with doing a little bit of things more ad hoc, a little bit more of your, take ad hoc notes and make sure that they go with it. Not necessarily in a structured diagnostic way. So it's a little bit more free form and free text and free way that you kind of use it. It's a little different. Certainly, I think everybody would say that for all of these applications, since you're going out to such a wide variety of a community, you need to have it to be simple to deploy because you're going to have to handle masses of people that are going to be using it, and then certainly easy to adapt. So from an easy to adapt perspective, obviously we tested against the fact that you really shouldn't have to do any training. It should be very, very easy to use and easy to deploy. Some things had already been commented about, which there's some great things in Mark's presentation about some of the physical conditions, the calibration and those items. The great thing about these last things in terms of physical conditions is there's a lot of other companies out there that are actually helping to solve some of these problems, and you don't actually have to rely just on yourself. So when we think about security and compliance, we tend to look at just generically for our own selves because we use a lot of iPads internally for our own applications, and our Salesforce has them, as to how do you manage security. So the great thing is that biometrics is becoming more of a standard, so you don't have to necessarily be worried about passwords. We have some users that have started to use some generic mobile device management applications out there, such as one called Good, where you really try to control what is actually able to be done on the iPad device so that you can't actually download anything to it. It kind of wipes everything clean. So the great environment here that we're working within is that there's a lot of stuff that's being done for the general industry that we will just make ours able to clearly be able to use in that regard. So those are the things, some of the things that we do. We do obviously also look to the FDA. We have, even though we did go through an FDA clearance similar to Mark. We learned through it. Actually, they helped pave some of the way. And so we did put our device through FDA and got it cleared, and that was a learning advice, and I think that's certainly one that we'll continue to keep track of. I think the other thing is we've started to realize there's some very unique environments that people are using these. So whether you're on public transportation and looking at something, or you're at a sports, you're in sports medicine and you're looking at the stuff on the sidelines, there's stuff relative to physical security screens that are starting to become more prevalent that you can put on the top of the device so you can actually view it, from a secure perspective. So there's a lot of great technology out there that's really coming around that's wonderful to see. It certainly helps us to advance this at a pretty rapid pace without, having to worry about it. I just put up one use case example. This is an example where we actually were participating with another vendor from a unit of healthcare called Spire Healthcare in the UK. This particular Spire Healthcare did have disparate systems from a PACS perspective. And all they really wanted was they wanted something that was more unique in terms of doing the collaboration and the viewing across the organizations. And so that's why, these mobility devices being a little bit more ubiquitous, a little bit more consistent and common even across vendors in terms of how they're doing it, actually helped to satisfy that use case of collaboration. That was really the problem they were trying to solve. So they can leave their specific vendor packs where they are and then just use the device for collaboration. So those are some of the things that we've learned as we've gone through this.